Hi, my name is Michelle Embleton, and in this video we're going to have a look at what is hysterosalpingography and why is it done. Hysterosalpingography is a gynecological test that is used to study the structures of the uterine cavity and the fallopian tubes. As such, it is part of a female fertility study. In this video, I'm going to cover when would the gynecologist order a hysterosalpingography, or HSG for short? What are the recommendations for having an HSG? What does it involve? And a look at the procedure step by step. We'll have a look at how to interpret the results of a hysterosalpingography, and then we'll finish by having a look at some of the most frequently asked questions and answer them for you. When a couple or a woman visit a fertility clinic for the first time, the clinic will first of all compile a detailed medical history to get as much information as possible. They will also want to order a series of tests in order to study the fertility of both the man and the woman. One of the frequently ordered tests by the gynecologist for the woman is the hysterosalpingography, or HSG. This test can sometimes be feared by women because of possible discomforts of the test, but it's a really important test in order to study the uterus and the fallopian tubes. Alongside the HSG, you will probably be given an ultrasound as well as the hormonal profile to completely study your fertility. Well, the hysterosalpingography is one of the most important diagnostic tests in studying female fertility. The test itself involves taking a series of X-rays of the woman's uterus and fallopian tubes. In order to do this, a special iodized contrast dye will be inserted into the uterus via a cannula, and then a series of X-rays will be taken so we can actually visualize what the structure of the uterus and the fallopian tubes is like. In this way, we can check that the uterus is correct and the fallopian tubes are permeable, which means that they are open and the eggs and sperm and embryo can pass through them. Unlike ultrasound, the hysterosalpingography is not a routinely performed test unless your doctor has specifically ordered it. Depending on your particular fertility clinic and the equipment and technology they have available, there is a further technique these days called hysterosalpingosonography, which, as the name suggests, uses ultrasound instead of an X-ray machine in order to do this process. Using the specialist ultrasound equipment, a special liquid or perhaps even a foam may be inserted into the uterus via the cannula, and then the progress of this studied using a transvaginal ultrasound. However, this is not readily available in all clinics. Well, to have a look at this, let's just go back a little bit and look at the process of fertilization. In order for natural conception to occur, the egg is released into the fallopian tubes and the sperm must swim up through the uterus, through the fallopian tubes, where fertilization takes place. Then the embryo will move down the fallopian tube into the uterus, where it will implant. Obviously, for this process to occur, the fallopian tubes must be permeable or patent to allow the passage of the egg, the sperm, or the embryo through the tubes. If there is any type of obstruction in the fallopian tube, these processes cannot occur, and therefore natural conception may be almost impossible. Hysterosalpingography allows us to visualize the uterine structures and the fallopian tubes to see whether there are any blockages present. It gives us a wealth of information and allows us to decide on the best course of action, whether it be an artificial insemination, IVF, or indeed some kind of reproductive surgery in order to help you become parents. In addition to assisted reproduction, hysterosalpingography may also be used in the cases of pelvic pain, pelvic tumors, or indeed to check that a tubal ligation procedure has been successful. As a hysterosalpingography allows us to study the structures, the internal structures of the female reproductive system, we can have a look at the cervix, the uterus, and the fallopian tubes. Indeed, it can point out possible abnormalities in the cervix. Abnormalities in the cervix could lead to cervical incompetence if the cervix is too narrow, too wide, or a possible duplication of the cervix in the case of uterus didelphys. Alterations in the uterus can also be visualized in this way, such as a septate uterus, a bicornate uterus, or indeed the presence of polyps or fibroids. It can detect problems in the fallopian tubes, so blocked tubes due to things such as endometriosis, which is where uterine tissue is growing outside of the uterine lining, or indeed inflammation of the fallopian tubes, salpingitis, or a collection of an accumulation of liquid inside the fallopian tubes, leading to obstruction, called hydrosalpinx. All alterations involving the fallopian tubes cause them to swell and become blocked, leading to a big obstacle in the process of becoming pregnant. A hysterosalpingography is performed in a similar way to an X-ray, and a contrast dye is injected through the uterus, and then X-rays are taken to visualize the structures. Proper preparation is important, and as the test uses X-rays, it is vital to ensure that the woman is not pregnant before performing the test. As such, the test is usually done at between days 8 and 10 of the menstrual cycle, with day 1 being the first day of the last monthly period. This ensures that the test is performed when the bleeding has finished and before ovulation occurs. There is no need to fast before this test, as anesthesia is not administered. However, you may want to take a laxative a few hours before the test to empty your bowels to give a better visualization of the reproductive structures. If there is any genital infection, this test should not be performed, and indeed your specialist may require you to take a prophylactic antibiotic before and after the test to ensure the risks of infection are very, very small. If you have pelvic inflammatory disease, bleeding between periods, or indeed have had any other type of test with a contrast dye injected into you or in your digestive system, this test won't be performed. The test itself is quite simple and takes between 20 and 30 minutes. It will take place in the gynecological chair, so in stirrups, as it would for a normal pap smear. Once the patient is in the proper position, the speculum will be introduced and the area washed with a saline solution to make sure that everything is clean and sterile. Then the contrast dye will be injected through the cervix by the specialist, and the X-rays taken to monitor the progress of the dye through the reproductive system. A series of photos, X-ray photos, will be taken. The process is not painful and doesn't require anesthesia, but it may be uncomfortable. So you could perhaps take an over-the-counter analgesic before the procedure. After the procedure, there is no special care that is needed. However, you may want to rest and take it easy for the rest of the day. It is also common for the days following the hysterosalpingography to have a light reddish or brownish vaginal discharge. In general, a patient is then recommended to follow their normal everyday life and follow any recommendations provided by their doctor. The results of the hysterosalpingography should be interpreted by your specialist, which is usually the gynecologist who has carried out the procedure. In the image, the uterine cavity can be seen as an oval or pear-shaped image with which is the uterus, and two thin lines coming out of it, which are the fallopian tubes. If the test is positive, it means the specialist can see the two fallopian tubes are permeable, which allows the dye to move through the fallopian tubes, and therefore there is no obstruction and everything is in working order. If the test is negative, whether unilateral or bilateral, meaning one tube is blocked or two tubes is blocked, the fallopian tubes have an obstruction which do not allow the dye to pass through. In these cases, the fallopian tubes usually inflate with the dye. However, it is also possible that your specialist cannot visualize the fallopian tubes due to a malformation of the tube itself. Based on the results of this test, your specialist can then recommend the best assisted reproductive treatment for you. For example, your specialist may recommend an artificial insemination if the uterus and fallopian tubes are permeable and you are under the age of 36 years old. However, if the tubes are blocked in any way, seminal quality is poor, or you're of an advancing maternal age, your specialist will probably recommend in vitro fertilization. Now we're going to have a look at a few of the most frequently asked questions from my users about hysterosalpingography and answer them for you. Are there any special preparations for a hysterosalpingography? Hysterosalpingography is a radiological examination that allows us to study the structures of the uterus, the cervix, and the fallopian tubes. Indeed, the patency, the permeability of the fallopian tubes can be responsible for between 20 and 35% of female fertility problems. As this is a somewhat invasive gynecological procedure, it cannot be performed if there is any kind of infection within the reproductive system. And your doctor will prescribe a prophylactic antibiotic before the procedure. To minimize any discomfort to the patient, you can also take an over-the-counter analgesic, an anti-inflammatory analgesic such as ibuprofen before the procedure. The procedure itself should be performed in the first half of the menstrual cycle, so between days 7 and days 10 of your cycle, which is when the endometrium has started to proliferate, which helps us to visualize the uterus. It is very recommended not to have sex in this part of the cycle when you are having the test to make sure that pregnancy has not occurred. Studies performed in the second phase of the menstrual cycle can lead to difficulties in interpreting the results and give you false results. Can I get pregnant after a hysterosalpingography? Well, this is quite interesting because the process of the hysterosalpingography involves the insertion of a liquid which will then move throughout your reproductive system through the uterus and through the fallopian tubes. If there is a slight blockage, the procedure itself may remove this blockage and sort the problem out whilst having the diagnostic test. There are cases that women achieve a pregnancy naturally after having had their hysterosalpingography. Are there any risks with hysterosalpingography? As an iodized contrast dye is used in the procedure, there are risks of an allergic reaction to the dye itself. There are also very small risks of uterine perforations or indeed infection. And as the process itself involves the use of X-rays, it carries with it the typical risks that taking an X-ray has. We would like to hear about your experiences, so please leave us a comment in the section below. And if you've enjoyed this video and found it informative, please don't forget to click like and subscribe so you don't miss any future videos. And as always, I would like to remind you that in the description below, I leave you with a link for an article all about hysterosalpingography where you can read about the topic in more detail.